Systemic racism has created healthcare disparities due to a lack of access and trust in the African American community that goes back centuries in America. The danger of this is urgent during the COVID-19 pandemic, as vaccinating our communities as quickly as possible is the most effective way to end the health crisis. Dr. Hashim Zaibak, owner of Hayat Pharmacy on Milwaukee's South Side, is trying to make vaccine access easy and open to eligible community members.
Double check the date, time, and everything.
Yep.
And
how long you've been doing COVID-19 testing, and when you started doing the vaccinations?
We started testing for COVID-19 back in May, middle of May 2020. Season to date, we have tested over 30,000 people.
The first thing we always hear is everyone saying, go to a portal, go online and sign up. And we know that there are thousands of residents all across Milwaukee and surrounding areas who don't have access to a computer or being online.
A lot of times the decisions like that are made in an office. Somebody's in an office think, oh, it's a good idea, let's do this, let's create this portal. People can go and it's a simple registration. But what's simple for one person might be too complicated for another person. And sometimes we assume that everybody is tech savvy. And the truth is, a lot of people are not. A lot of people struggle with the internet. And at the beginning, we thought like that. We were just like, oh, let's just put an our portal where people can go on the website and register. We got a lot of complaints. People were like, no, we don't want to do that. It's too complicated. So we started offering walk-in clinics. And since we started offering the walk-in clinic, people have been so happy. In the morning, usually there's a line, but now they're actually getting caught up.
So now that you've started doing it, what are you seeing as far as the numbers of people that are coming in to be vaccinated?
The number has increased significantly since we started offering walk-ins. And make sure that they qualify based on the state guidelines, which changes frequently actually, so we have to make sure that they qualify based on the current guidelines.
Right.
And then when we're done, we actually walk them here, or they walk to. Sometimes we assume that everybody is the same. Sometimes we assume that everybody has an email. We assume that everybody has a smartphone. We assume that people are able to download an app and easily register. And really, truthfully, a lot of people don't have emails.
I've been trying to get in somewhere for weeks now, and to no avail. And I just heard about this place and they said, you can walk in. I called yesterday, and so I didn't need an appointment, so I thought that's the place to go. And I walked in less than 10 minutes and everything was taken care of, and it's wonderful here.
When you ask people to register and you ask them, what's your email? And it has an asterisk next to it, so if you don't put the email, you can't press next. They're stuck.
Yeah, I'm not really that computer literate, so this was perfect for me.
If that person was my grandmother or my grandfather, I want to offer them other options. When it comes to setting it up, we just told people, if you want to make an appointment, that option is available. We still have the platform to register. 1, 2, 3, but for the senior citizen who just doesn't want to register and they want to walk in, we told them from 9:30 to 4:30, you're welcome, come in, and we'll take care of you. If you qualify based on the state guidelines, we'll take care of you. You're done.